Welcome, colleagues, to KSU's Research with Relevance Friday Features. We are back again for the second show of the season, and this season we're featuring our deans. And today we are live streaming from we're live streaming on KSU TV and from the beautiful Perelman Hall in Kennesaw campus. Woo, I gotta be reading my script here. Okay, we are being joined by Dr. Monica Swahn, who is the Dean of the Wellstar College of Health and Human Services, and we're super excited to have you here today, Monica. So that's the first time we've gotten applause before we've done the show, so that's very encouraging. My name is Phaedra Corso. I'm the Vice President for Research, and it's been my pleasure to be the host of this show for, oh gosh, it feels like 10 years, but I think we're in year 2 right now. And one of the reasons why we started this show, as many of you know who've been watching all along, is that we've really felt like it was important for us to stay connected as colleagues, particularly through the pandemic, but also to highlight the great research that is being conducted at KSU. So a few housekeeping tips before we start. So first, to our live audience, we will be opening it up for, someone almost clapped for the live audience, that's great. We will be opening it up to questions from you all. So we just know that there are microphones on both sides of this auditorium, so we'll ask that you step up to the microphone if you want to ask a question. Second, if you need to leave the auditorium during this live broadcast, we ask that you leave but don't come back in because we want to be careful about how the door sounds. And then since this is a live stream, I would ask you to please silence all of your electronic devices during the show. And then for our virtual audience, we are filming on KSU TV, and there is an ability to send chats in. It's called Discus. And it's a comment section below the video player, and you will post as a guest to avoid having to create a Discus account if you want to. So you just click on the little button that says, please, I'd like to post as a guest. And then my job is going to be to look at your posts and ask those questions as they come in. We are moderating questions behind the scenes, so just know that there's going to be just one small filter before it gets to me to ask the question. So for everyone who's participating, just please know that this session is being recorded. So if you miss it or want to share it with your friends because it was so fantastic, you'll be able to go to our YouTube channel and see the video later on this weekend. So our schedule is the same as we've been following throughout. So for the next hour, we'll be first watching a video giving an overview of the research of our featured dean, Dr. Swahn, and then we'll do the live interview. So again, if you're part of the live audience, please use one of the designated microphones, etc. All right, here I go. I'm going to introduce our guest today. So Monica Swahn is a psychiatric epidemiologist and public health scholar. She joined KSU in the spring of 2021 as the Dean of the Wellstar College. I'm proud to say that I've known Monica for 20 years now. We were both pregnant with children at the same time, and that's how we met each other. We kind of bellies bumped each other in the in the restroom at CDC. Her research pertains to youth risk behaviors and how alcohol exacerbates risk for violence, injuries, and HIV. She strives to use her research to help those in need, particularly youth, as they struggle with various issues that affect their communities, which I think will be very obvious when you see this video. Over the past 15 years, Monica has worked with vulnerable groups globally, focusing on regions in West and East Africa. This international work has been recognized by the Sheth Distinguished Faculty Award in 2019, so congratulations for that. Prior to KSU, she served in a variety of roles at Georgia State University, including the university's Associate VP for Research. She also held several positions at the Centers for Disease Control and Prevention, including in the Office of the Chief Science Officer. She is originally from Sweden, and Monica holds a PhD in epidemiology from the University of Pittsburgh. And with that introduction, let's roll the video.
My name is Monica Swahn, and I'm the Dean of the Wellstar College of Health and Human Services at Kennesaw State University. I joined KSU in the Wellstar College in March 2021, and I have been so grateful for the warm welcome and our strong focus on student success and research with relevance. and I find it to be a true privilege to lead our Wellstar College. As a college, we are growing rapidly, and we have amazing faculty, staff, and students. In terms of research, we are doing great work in many areas, but most notably related to health disparities, trauma, vulnerable populations, youth studies, fitness, and community engagement. My primary research interest is in adolescent and young adult mental health, a topic I have studied for some time. Primarily, I have focused on health risk behaviors, alcohol and drug use, gender-based violence, and mental health concerns. I'm trained as a psychiatric epidemiologist, which is a field within public health that investigates the causes and consequences of mental illness. And in my case, I look at mental illness in a broader context, focusing on the structural drivers and consequences of poor mental health, particularly in vulnerable and understudied populations in low-resource settings. So my research by nature is quite interdisciplinary, and I typically work with researchers who have a range of expertise. An area of great interest to me is how alcohol use and violence, for example, intersect with HIV transmission. This is a research topic I first pursued as a Fulbright scholar at Makerere University in Kampala, Uganda. Over the last 10 to 15 years or so, I have been immersed in global health work. This work has really focused on capacity building for research and alcohol policy development, working with community-based organizations, particularly in West and East Africa. But mostly my recent work in Uganda has been centered around understanding the urban disadvantage and health disparities among youth in the slums of Kampala, the city of 7 hills. Youth in the urban slums across sub-Saharan Africa have largely been neglected from public health research, despite their extensive health disparities and available low-cost interventions. Given rapid urban migration and population growth in Uganda, the number of vulnerable youth who live in the slums are exceeding the availability of government services and support. Basic public health research that describes key risk and contextual factors can identify those most vulnerable and guide low-cost interventions to improve quality of life and mitigate the risk among those that live the urban disadvantage. In the last 5 or so years, there has been a new focus on the urban disadvantage and the context of cities in global health. It has become very obvious to us with the COVID-19 pandemic as an example, how vulnerabilities to a range of health concerns may be exacerbated in cities, specifically in densely populated environments and also those in low-resource settings. So let me tell you a little bit about how this work got started and what my research has focused on regarding the urban disadvantage in the slums of Kampala. And just so you know, Kampala is the capital city of Uganda. It's a landlocked country in sub-Saharan Africa with over 40 million people. And in Uganda, about 50% of the population is 15 years and younger. About 10 years ago, I met Rogers Gaziri, the executive director for the Uganda Youth Development Link. I'd heard him speak at a conference in Denmark and was so surprised when he outlined the high levels of alcohol use and harm in Uganda, a country I knew nearly nothing about. Because I was so interested in learning more and because there's such a shortage of psychiatric epidemiologists in Uganda, Rogers invited me for a visit. During my first visit in 2010, I saw the great work that Rogers and his organization was doing, uplifting youth in the slums through mental health services and through vocational training. But there was so much need, so few resources. It was and still is a very complex environment. And to be honest, I wasn't sure how I could contribute. What could I do to help? Previous to that trip, I had traveled quite a bit, considered myself a world citizen. I was already a mother of 3 children, and I had worked at the CDC as an epidemiologist for 10 years. I thought I had relevant experience, but I just wasn't sure how to move forward and how to best contribute. I returned for a second trip, and this time I was more prepared. I had been briefed by colleagues, and I really knew so much more. We developed a strategy focused on the research needs, and our goal was really to determine the unmet health needs in this understudied population. That second trip proved to be life-changing and was the launch of a new research agenda centered around community mental health, capacity building, and policy development in East Africa. Through these initiatives, I gained so many fantastic collaborators and really a new life, and I believe we have really made a difference. Over the years, we have conducted different research projects, including surveys, focus groups, and community mapping of alcohol marketing and sales. We're also developing new tools to support capacity building and to facilitate new research. One such tool is the slum rating scale, which really simplifies the measurement of alcohol outlets and sales in the urban slums. In terms of the urban disadvantage among youth in the slums, we have written many different papers examining unmet needs pertaining to child maltreatment and sexual exploitation, involvement in sex work, psychological distress, suicide ideation, alcohol use, alcohol marketing, problem drinking and alcohol-related harm, gender-based violence, HIV and other sexually transmitted infections, homelessness, and psychosocial factors associated with service seeking and vocational training. In terms of the structural drivers, a few years ago we had a National Institute of Health grant to examine alcohol marketing in Uganda and found that it is very aggressive. Our analysis of the content of these alcohol ads also showed that many of the alcohol billboards violate industry standards. Uganda, like many other countries in sub-Saharan Africa, have very weak alcohol policies and limited enforcement. As an example, in some settings there is no minimum price for alcohol, and in many cases alcohol is cheaper than water. The work in Uganda has had a positive impact in many ways. We have launched a virtual alcohol, drugs, and addiction research center at the School of Public Health at Makerere University. I also led a study abroad program to Uganda for several years, which enabled my students to participate in our ongoing projects, engage with my collaborators, and of course visit Makerere University. This work has also led to collaborations with organizations across other countries and even allowed me to present at side events for the United Nations Commission on the Status of Women in New York for 3 different years. The community-based organizations that I work with have used the data we have generated to strengthen their services and outreach activities and also to brief decision makers. For example, we have found that alcohol use is a key concern among young girls and women in the slums, and actually a high proportion of these girls who drink alcohol can be classified as problem drinkers, which is a significant concern. We have also found high unmet mental health needs, high levels of distress, sadness, and violence exposures among these girls, which really seem to be driving their alcohol use. Our research has also been used to inform alcohol policy development. I have worked with a writing team assembled by the Ministry of Health in Uganda to draft an alcohol control bill that is still awaiting adoption. I've also briefed other government agencies in Uganda about my work, including the Ministry of Trade, the Ministry of Gender, and also the Kampala Council City Authority. The work has also really transformed me, made me a better person, and led me to approach life with more passion, humility, and appreciation. These past 10 years of global health work have really been a gift to me, and I'm full of gratitude for my collaborations and the many ongoing projects that have resulted in the difference that we have made. My Ugandan name is Chirabo, which means gift in one of the local languages. So my name reminds me every day about the important work that we do, the opportunities we have to make an impact, and that with passion and perseverance so much can be done, however daunting. This is my research with Relevance, highlighting and addressing the needs of the vulnerable youth who live in the shadows of the 7 hills in Kampala, Uganda. But so much of my own work fits seamlessly into the research priorities and strength that we have in the Wellstar College. We address health disparities, we improve well-being and health of vulnerable populations, and we seek to uplift those who are underserved. In my mind, I can't imagine doing anything more important or fulfilling than what we do together in the Wellstar College.
Have I mentioned that the name of the show is Research with Relevance? Because I just don't think there's a finer example, and I just love that Dean Swahn has given us such a personal look into her research, and the story that you tell about how it's impacted you is just lovely. So thank you. I have a million questions, and I can spend the next couple of hours if y'all are up for it. But I am going to start with one, but I want you to feel super comfortable coming up to a microphone because I want this to be an interactive session as much as possible. So let me go ahead and start the show. So this work, obviously you've been building on this for years. Mm-hmm. You are now here at Kennesaw State, and you've got a very challenging job as a dean, but what are you hoping to do to continue this work? Because I know research is still part of your passion and what you want to do. So what are the next steps?
So that's a big question, but thank you for that. I consider myself a researcher, and I think it's really at the core of who I am. But I think what the beautiful part here of being the Dean of the Wellstar College, and which I was trying to outline here, is that my work really overlaps really a great deal with what our amazing faculty are doing. So for me, it's more about integrating my work with what is already ongoing. So I think that, sure, am I busy? Absolutely. But it's also about integrating our research with the other parts of what we're doing. In my previous role at another institution, I integrated a lot of my research with my teaching, for example, and that was another way to really move things forward. So I think we can do similar things here.
So you have wonderful pictures there of bright, shining faces of students that you've brought abroad. Are there plans for you to do that here with KSU students?
I would love to. It turns out that we already had, previously to me joining Wellstar, a program to Uganda. And I know that many of our faculty are very interested in global health work. And so, I have a program ready to set up. I think it's just a matter of engaging other faculty and seeing if we can make it happen. I would really love to.
Any students in the audience want to go on that trip? Because I know I do. So you talk about your Fulbright. There's several in your college that have had Fulbright scholarships. I've had a Fulbright, been fortunate enough to have a Fulbright. What are some recommendations you would give to faculty who would like to pursue a similar type of endeavor?
I mean, I think the Fulbright is just a phenomenal experience. I've never heard anybody coming back from a Fulbright and said, it wasn't worth the time. I think most of us would say it was truly transformative, and transformative in a very different way, depending on which country you go to. I had worked in Uganda maybe 5 or 6 years before I decided to do the Fulbright, so it was sort of easy for me to map out a plan. But I really encourage faculty and students to really consider it an option. And if you've not looked at it recently, I mean, there's new ways of doing it. Because of my other responsibilities at the university, I couldn't take sort of a year off and leave. So I spread mine out over 3 years, which worked really, really well. Because what I was doing was really setting up a new research center for alcohol and drug addiction prevention. And we couldn't do that just in one setting. So we spread that out, which I think was really helpful. So anyway, I encourage anybody who's interested to reach out to those of us who've done it before and really look at the website and see which part of the world that they might want to engage in.
So is it calling up somebody in another country and saying, hey, I've got this great research idea I want to bring to you? Or is there a little bit more to it than that?
I'm sure that happens quite a bit, but that's probably not the best way to get something really great out of it. I think as with everything, as with all the projects that are meaningful and impactful, it really requires, as we call it in Uganda, networking with your feet. But if you can't visit in person, I think really reaching out and engaging and really sort of setting a stage so that that work that is done on the ground becomes really meaningful.
So you talk about your NIH funding that you've had previously. So why would the federal government, our federal government, be interested in this kind of research?
I think it's a great question, and it's typically much harder to get NIH to sponsor global health work. I mean, you really have to make a compelling case for why that work matters to U.S. taxpayers, right? We have to say, why is it relevant to the U.S. or what we do here in terms of public health, except, for example, HIV-related work. It turns out that the grant that we had that launched some of this research was related to alcohol use and HIV among the kids in the slums. It turns out that particularly for young girls, the transmission rates have been very high and they've been an underserved group, and so we were looking how alcohol was driving that, and actually the funding was to develop an alcohol counter-marketing intervention. But I think in general, as you know, one can apply for funds for all kinds of topics, but really have to have a compelling rationale. The other work that we have done and tried to seek funding for is alcohol policy development, and that is a different aspect altogether. But for example, doing that kind of work in Uganda where alcohol control policies are very weak, it shows us what the results are when the environment is totally different.
All right. I thought we had a question coming in, but no, it was just a congratulations, good work.
Well, we'll take that, thank you.
Multitask at the same time. So are there plans to take any of the research that you've done and translate it here to Georgia, to the US? Have you found collaborators or colleagues here at KSU yet?
Oh, absolutely. I mean, it's just amazing the talent that we have across the university. And let me just sort of say this too. I think, unfortunately, we're a well-kept secret. We do a lot of community engagement research, and what some people call public impact research, right? We have a profound impact on our communities, but we've not told those stories. But yes, I have found some tremendous collaborators already at other colleges and also within our college, and so really trying to build on that and figure out how we were going to sort of position ourselves and build those, collaborative relationships. I think some of the work that I have done that we can really translate here is, for example, mental health services and how we work in low resource settings. I mean, it's amazing what an organization like the Uganda Youth Development Link can do with minimal resources. I think sometimes, we have a rigid approach in terms of how we deliver services and care, but putting ourselves in a different situation, we can really see how peer education, for example, can be really transformative. So we have a lot of lessons to learn from other settings that I think can really be transformative here as well.
I encourage you, oh, thank you. If I could just swivel my head, I would actually see that there's a question in the audience. Please go ahead.
Am I on? Anyway, can you hear me?
Yes.
Yes.
Super. Well, Dean Swahn, very impressive work, and it's very obvious that you're passionate about it. I have a question regarding your day-to-day work here as a dean and how you manage to, at all hours of the day, get on phone calls and continue your work. And could you just tell us what you do and how you do it? Because I had an office a couple of doors down from you, and I would hear you on a call with several people. What are you continuing to do with that?
So thank you, Susan. It's a great question from the director of our School of Nursing, by the way, who also multitasks and does phenomenal work. I think it's easier for me to do this work because I'm passionate about it, as you said. If this wasn't important to me, it wouldn't get done. It's about priorities. It's also about the need, I think, for giving back. I feel like I have promised my collaborators, in particular in these settings, right? They invited me to do this work because they are not many professors or psychiatric epidemiologists or people who are interested in doing this kind of work. And so they have sort of invested time and energy in me, and I have raised their hope in terms of what we're going to do together, and I feel really sincere about giving back. But back to the time management, this is something that I thought long and hard about before, deciding to pursue being this kind of, leadership role. But so far, so good. I think the multitasking and sort of the scheduling that I do, trying to protect some time every week. And as another fellow dean colleague shared with me too, in a position like this, you're all in. It's not like you're just dean, 7 to 5 or 7 to 6. I mean, as a dean, you're always a dean. You represent, you engage, you always think about strategy, you always think of what you're going to do. So it's a matter about fitting this work in, where it fits, sort of.
Mm-hmm. We had I'm in parentheses here for a second, but we had a meeting this week with our NIH project director, and we were talking about how do we recruit freshmen into the research enterprise? What are we looking for? Because so many of our freshmen don't have the research experience in high school. And our NIH director said, you don't need that experience. You need two things from your freshmen. Mm-hmm. You need passion and you need consistency. And if you have those two things, you're going to have someone who's going to be a great addition to your research team. And so we all sat there and wrote it down, and I was thinking faculty are the same. I mean, there's no difference. You just have to have passion for what you're doing, and then just keep doing it, because you're going to get a no every once in a while, and that's okay. So.
But I left a really important point out, so let me make it now. I have a phenomenal leadership team around me. And without that, there is no way I could be doing this, right? I mean, as a leader, you have to delegate and you have to trust other people and trust their judgment. And if you cannot trust your leadership team, you really won't get anything done. So I want to say thank you to them for what they do as part of leading our college every day.
And she made them come to this presentation today, and here they are. I'm just kidding.
Thank you.
Sorry, I wanted to be a stand-up comedian, but that failed, and so here I am. Okay, so let's talk about COVID, because you do, oh, I'm sorry. I'll talk about COVID in 1 second. Now I'm going to turn to another question from the audience. Mark.
You can talk about COVID if you want to. That's cheery.
Yes.
Thank you for sharing this, and just personally, thank you for the work that you and your team are doing. It's so gratifying to see really personal passion towards something that makes such an impact on lives. But it occurs to me that this is such a huge problem. You're tackling something that's not only a big city, but you're talking about a national scale with the numbers you were sharing. Those were difficult numbers to see. And I wonder if, I know you've been doing this work, is it improving? Are we there yet? Are there success stories yet? Or is it just that the problem is so big that we're just figuring out how to take steps toward improvement?
Thank you, Mark. And I think it's a really, really, of course, very, very important question, and one that I get often. You know, when a problem seems so big and daunting, does that mean we should just give up? Does that mean we shouldn't even try? And so I decided I couldn't do it that way. You know, as long as there are other people working with me, right? And I'm there to serve what they are doing. And so in the case that, of the work that I've done, in particular with the Uganda Youth Development Link, that are providing vocational training, for example, to uplift people in the slums, turns out, I think is particularly important for the young girls who may not have other opportunities. And again, if they don't have other opportunities, they, you know, substance use as a coping strategy, you know, sex work, the survival, you have to survive. And so I think that we are presenting another model potential of mental health intervention that instead of mental health, which is typically under-resourced in many countries, and I would say even our own, that vocational training, for example, which many can get behind because it's sort of educational, right? It's skill building. If that really changes the path in terms of mental health outcomes, you know, that is, I think, transformative. And so I think we're building models. We're trying to create an evidence base for strategies that decision makers or governments or philanthropic support can really engage with and make a difference. But yes, the need is big, but I think it just means that we need to step up and think more creatively about solutions.
Mm-hmm. Another question.
Good afternoon, Dean Swahn. My name is Nuru Akinyemi. I'm director of the Center for Africana Studies here at KSU. This is a very important work that you're doing, and I want to congratulate you on that. Now, you're dean, you have a lot of responsibilities here. Our colleagues in Uganda continuing this work. Are there chances of this translating into policy? Mm-hmm. So I suppose, what's the next step? Mm-hmm. Thank you.
And thank you, Nura, and thank you for the important work that you lead in terms of organizing and leading the people who are involved in this kind of work on campus. So I think it's a critically important question. You know, what are the policy implications? I think of all the research in Uganda, as an example, that we've had most impact in terms of policy development is in the alcohol sphere. So because of us having demonstrated the role of marketing, for example, marketing violations, and you know, comparing and contrasting, I often get a question from people in Uganda, you know, who've never traveled outside of the country. You know, why we're studying alcohol and alcohol marketing, is that really a problem? And when you're immersed in an environment that is so filled with alcohol and alcohol-related harm and alcohol marketing around you everywhere, it might be hard to really understand that in other settings it's not like that. Mm-hmm. I've been telling my US students for a long time, and actually I used to teach a class on women and alcohol, and in the beginning of the class we talked about, you know, what the policy environment is in the US and how we take for granted, for example, that our alcohol is controlled, and if you drink alcohol, sure, alcohol causes harm, but the ethanol is a poisoning, but you don't have to worry about other ingredients, you know, harming your health, for example. So, you know, trying to compare and contrast. So anyway, so the research over there, in particular, I think violations of alcohol marketing agreements and such really has had an impact. So for example, they used to sell alcohol in small packets, you know, that you could really stick in your pocket. They were sold very cheaply. They're called alcohol sachets. So the government has banned those. I mean, I wouldn't say that was single-handedly my work, but it was part of a broader team effort in terms of understanding how kids are drinking and, you know, the harm that is caused by that. And I think focusing on young people has been important in that policy development as well, because, you know, we can argue, as we do here in the US and in other settings, you know, what it means to restrict alcohol and alcohol access and all of that. But most of us would sincerely agree that protecting the children and the youth is something that we can all, you know, agree on that should be a priority. So I think through those kind of strategies, I think that we've had a substantial impact.
Excellent. Another question?
Yeah, Monica, I know you've been doing this work for quite a while. I know you have laid a lot of good foundation at Georgia State University, particularly with our PhD students. Now, what do you have in stock in terms of continuing that type of collaboration, particularly when it comes to our graduate students and working with Georgia State University? Yeah.
Well, thank you, Ike, and such a pleasure to see you. So glad that you're here, fellow colleague of mine at Georgia State. So it turns out that I'm still fairly involved with the PhD programs and the students over at Georgia State. Might point out that one of my former doctoral students, Jane Palmier, is here. And you know, was one of the students who joined me early on, even as a master's student, to launch this work. She helped me write the original grant proposal that got us over there and get the commitment from the university to really launch that. Now, she has since graduated, but I have another student who's lining up to ask a question, who I'm working with, who is working on an MPH. But you know, I would hope also that, you know, there are PhD programs here at KSU that I think we can also, as a college, be more engaged with. And you know, as many of you know, as part of our strategic plan or our R2 roadmap, growing graduate enrollment is key. So I think for us to grow our research, we really need to strengthen our graduate programs, and I think PhDs will be really a necessity for driving that research and make a difference.
Thank you.
Hi, I'm Kelly. I admire your work so much, the fact that you have a fulfilling, meaningful career and are doing such important work in Uganda and elsewhere. I've worked with Dr. Swahn on some research dissemination activities. I'm a MPH student, and I'm just wondering, with your research, we've talked about the importance of getting your research outside of the quote-unquote academic bubble. What are some of the ways and the value that you see of doing that, and how are you going about it?
So thank you, Kelly, and thank you for that question. And Kelly is an incredibly talented student, and to answer your question, I hope you don't mind me putting you on the spot, but Kelly has really been instrumental working with me. You know, since joining KSU, we've had at least 2 webinars where we have showcased some of the research that we have done, particularly in West Africa and also in East Africa, to take surveys and research and really sort of translate it into you know, meaningful summaries for our community-based organizations that are really trying to use this work and really transform and get resources. And Kelly has been really just amazing organizing those webinars and, you know, sharing the information in a way that is accessible to people who are not researchers or scholars. And so thank you for that.
And you took my question, Kelly, so thank
Oh.
you. Thank you for that.
But maybe I should also chime in that I think it's something that, as a college and as fellow scholars, this is something that we really need to be sincere about. You know, especially when we do community-based work, we really need to circle back and share what the findings are. You know, and it's that continuous relationship that also, I think, you know, help us identify what the next research questions are and how we can contribute and really make meaningful impact in the communities.
Absolutely, and we have a wonderful StratCom person in our office, Joelle Walls, who handles a good bit of the research communications for the university, and we're about to double Joelle because we realize how important that is, and so so I agree that's a really important thing. I want to go back to COVID here for a second because so much of what I've been hearing in the news about the impacts of COVID are on substance abuse and mental health issues, which is your area of expertise. So I'm wondering if you could speak to what you're seeing here in the US, but also whether in keeping up with your colleagues in Uganda, whether they're seeing similar trends that we are here.
So, I mean, COVID and the impact of COVID, and it's still obviously not over. We're seeing a tremendous impact, even though if rates are going down here in Georgia and in our country. I mean, I think we can't really separate sort of the physical, the impact on people's health. You know, people have been sick and people have experienced the illness or the virus themselves, but the mental health impact. I mean, I talk to colleagues about that all the time. The impact on the kids who have not been able to go to school or have had to modify, you know, how they've accessed their education, families. I mean, the unemployment levels. I mean, there's been so many different structural drivers, I think, that have driven the outcomes of it. And there's going to be years and years until we get through this. And we really, I think, have to step up all kinds of services to deal with it. And I think in Uganda, the situation is different. The US is such an extreme example about the adverse impact of COVID. I mean, we're one of the countries with the worst levels and the most dramatic impact at all levels. Interestingly, I was very worried about Uganda, given, again, working in the urban slums, what, you know, transmissions would have looked like because people live in such close proximity. But it turns out that, at least in the official records, that transmission levels really never got that high. That said, you know, hospitals were still full, and but it seems from a mental health point of view, the changes during the pandemic, meaning the lockdowns, I think have had an equally sad impact, adverse impact, again, on people's livelihoods and education for children in particular. And so we're going to see the consequences of that. And in some countries, you know, the research is still not out, as, you know, we're still through the pandemic, but, you know, substance use and coping strategies seem to have really escalated. Violence, child maltreatment, there's a lot of those issues that have been exacerbated at multiple levels. Again, it's going to take a long time to kind of get back to where we were. And also I want to just chime in too, the opioid epidemic. We don't really talk about that. That was raving before COVID, and we all talked about, you know, the devastating outcomes. That is still there. It didn't go away. It's just that we just have not gotten the kind of attention that I think. And so, you know, all of these are really exacerbating. And you know, we're a country in pain in many ways.
I encourage those who are watching on KSU TV to submit a question via the chat function. And we have another question at the microphone.
Hi there, Dean Swahn. I just want to take the opportunity to continue a conversation that you and I were having in your office the other day, pertaining to the idea that the great health challenges of our time index back to problems of health justice. And I think that the ways in which your work relates to health justice are quite clear, but I'm just wondering if you could talk about how you think about health justice and how it relates with your work.
So a very important question. You know, I think I like to frame it around health disparities, you know, really trying to figure out how to increase equity in health. You know, I think Phaedra mentioned I'm from Sweden, so I'm not saying that there are no health disparities there, but I certainly think that the Swedish system was very proactive in ensuring access to health, for example, and making sure, you know, I grew up in a poor environment myself, and I was taken for dental checkups, and I was taught how to swim by the system, right? I mean, all of that kind of social welfare and social systems were embedded. It's not quite like that anymore. But I'm certainly a product myself over what those systems may look like and what those systems may produce. I think we have a long way to go in the US. You know, I talk about the urban disadvantage in the video. We could have very likely talked about Atlanta, one of the cities with dramatic disparities. I mean, we are one of the most vulnerable cities, if you will, if you look at the Gini index in terms of disparities within just one city. So, you know, we're not going to be a healthy nation until we're all healthy, right? I mean, and that is the concept I don't think people really have grasped. Holding people back, whether it's in poverty or in poor health, really makes us all vulnerable. And I think COVID has really been an example of that. And we've had a lot of lessons learned, and I hope that we'll really look at those lessons and really make a difference.
Great, thank you. We do have a question online, and this is from Nick. He says, "Hi, Dr. Swahn, thank you for the work that you've done. In your opinion, are residents of areas like Kampala open to the idea of mental health intervention and treatment in comparison to how it is generally received in the US?"
So I think it's a very tricky question. You know, we've talked a lot with my colleagues about stigma for mental health, stigma related to HIV. It's an area of research interest to me too, how we overcome that. I think we see a lot of it here in the US, we see it in other countries. So Yes, we see it in Uganda too, and that's usually where we try not to couch it as a mental health intervention per se, right? It could be skill building, it could be, coping skills and strategies. Like there are other ways to frame it that does not seem so threatening or so potentially alienating. I mean, nobody really wants to come forward and say, I have a mental health issue and I
Or
need
I'm
help.
depressed.
Exactly. I mean, people struggle with that. So, it's about using the terms in appropriate ways, but a very important point. Stigma is something that we really need to come together. And again, I want to make that point too, because we're talking about mental health, and I've seen a lot of debate about let's not use mental health, let's just use health, right? Because we do this distinction between physical and mental health, even though we know that they're so interlinked that it really doesn't make sense to do it that way.
Another question?
Like you, Fezra, I probably have 100 questions, but I'm going to stick to 2, if I may.
All right.
This was no different than India. I mean, the pictures I saw could be Mumbai, and the largest slums, I think, in the world are in Mumbai, so this could really relate to that. I've got 2 transatlantic questions. So the lessons you have learned from conducting research, very organic, community-based participatory research is what it appeared to be, and I'm sure it was. What lessons did you learn in the research process that we could use here in Atlanta to deal with the very same issue, with the opioid deaths, the mental health, the suicide rates are through the roof. We heard about that the other day. How can we use the research design and method here? That's question number 1.
Okay, so let's take question number 1. So thank you, Monica. I think, to really have the most impact, it has to be community-based, it has to be community-engaged. I think as researchers and scholars, we have to listen, we have to invest in those relationships. And, I think for many of us, and sitting on the academic side, I know the pressure that our faculty are under in terms of promotion and tenure and demonstrating impact and publishing. Unfortunately, this kind of work takes much longer time, and unfortunately, it's often much harder to publish. So we need to find that balance between where are we in terms of community engagement and public impact research, as well as also demonstrating that impact, but allowing faculty that flexibility to do the kind of work that in the longer term might have more impact, but might be harder to showcase in terms of productivity. So the lessons learned, though, to your how you frame the question, is that you have to be patient, and I think humility is very important, and that's not necessarily a skill that we're trained as researchers, because we're trained to be experts in a particular area of research, and that's very, very important. But when it comes to connecting with the communities, we have to sort of set that aside and figure out how we can work better together. I mean, that would be the key big lesson.
Thank you so much. Question number 2. Depending on which part of the world you're in, lack of income is what I'm going to call it. I'm not going to call it poverty, but lack of income, steady income, violence, terrorism, and then substance use are highly correlated. So have you thought about doing research or engaging in research where all these elements are examined concurrently? I know you've looked at mental health and HIV, but violence now with poverty, lack of income, terrorism, there's a high correlation. I mean, look at Afghanistan right now. Look at what's happening in Pakistan with poverty and violence and terrorism and cross-border terrorism. They're all highly correlated elements. Your thoughts on that?
Oh, Monica, I agree. A lot of these things are linked, but unfortunately, again, researchers tend to, look at one specific health topic at a time and not necessarily how things are linked. But the research team that I'm working with and my former students, we've looked at something we call the SAVA syndemic, which is how substance use, violence, and HIV, for example, are linked. And we know poverty, too, is an incredibly social driver, to exacerbate vulnerabilities in other areas. And so I think, and also the National Institute of Mental Health has really pushed more of a research agenda looking at the social drivers, including poverty and other structural drivers that really exacerbate other vulnerabilities. So I think we'll see much more of this because, they will lead a lot of this and perhaps also provide funding for some of this work that I think will be critically important because whenever there's more resources, people are more eager to get involved. But I think you asked the big question. These are going to be very challenging to solve, but we need to do the research first.
Yeah, I think it's a great question, and as a reviewer for NIH, I'm seeing a change from 10 years ago where the funding was very much topic by topic to now being you have to have a multidisciplinary team to be even competitive. So they're seeing, and like the Robert Wood Johnson Foundation is another good example, you can't get Robert Wood Johnson Foundation funding unless you show that education and health and crime and substance abuse and all the different fields are in each proposal. So hopefully we're moving towards that model. Another question? Yeah.
Yes. Hello, Dean Swahn. Thank you for the interesting research that you have done. Actually, I'm impressed by that, and the reason is that I see that looking into a multifactorial problem and spending like years on that, it would be challenging, and so I'm really impressed, and thank you for doing that. And I'm really thankful because I see some people in the world that spend their time on that. So my question is about and actually is for people who want to continue your study. My question is related to possible intervention that people may want to have for that problem. Because alcohol has a sort of a role in changing and alteration the dopamine release. So mental health could be a reason for that or impairment in mental health. So based on the data that you collected so far, because I can imagine you look at several factors that may cause and may push people use and drink alcohol or overuse alcohol. So do you think if people or researchers want to spend some time to find a way to treat the problem for that people, it would be better to find a solution with policy making, or it would be better to find a solution for improvement of mental health? Thank you.
Wow. Thank you so much. That's a big question. I think a little bit of both. I wish in a setting like this, the policies could really be expanded, but I think in a setting like this, when there's so many pressing health issues, advocating for mental health specifically, I think just falls farther down the priority list. And in terms of your questions about what our research found, we had some survey measures on girls, for example, drinking at night to cope with their stressors. And what we find is that gender-based violence is a key risk factor for that drinking. So back to that whole sort of intersectionality, if you will, with these multiple layers of vulnerability. The girls who are exposed to violence early, are on a totally different trajectory, and that is something that we need to figure out how to stop. I think adolescent and young adult health has also, I wouldn't call it neglected, but it's not been prioritized. There's been a lot more work on, I think, 0 to 5, to the youngest children. And I'm not at all disagreeing with the importance of that. It's just that when we get them through that age period and they're becoming, adolescents and young adults, there's been just much less resources. And that's where a lot of these vulnerabilities really take hold. And if we haven't provided some mitigating strategies before then, they're on a trajectory that is really hard to alter. So if they're starting having sex early, they're not using condoms because, for example, they're involved in sex work, they get more money for it, then they get HIV, and sort of there's a whole different cascade that is much harder to change than if we had earlier interventions. So yeah, a little bit of mix of both.
Great question. So we're coming to the end of our time, but I'm going to take the host's prerogative here and ask, I think, a question I've asked many faculty and deans who've been on the show, and that is to think big. You're a big thinker, and if you were so fortunate to have either the federal government or an external donor that came to you and said, Dean Swahn, here's $5 million or $10 million, what would you do with that funding for you, your research, and your college?
Ooh, big one. And maybe somebody's listening who has those kind of resources.
We're planting a seed.
Planting a seed. I think I would really build on our initiatives in health disparities. We have a lot of strength in our college, but health disparities is something that we have colleagues across the university who's really interested in. And, some people also ask me, our college has such diverse interests and we have such, great variety of academic disciplines, and how can we bring it all together? I think instead of focusing on our differences, our common theme is really vulnerable populations and health disparities. So as Center of Health Disparities perhaps focus on vulnerable populations. We have researchers who are interested in, our rural community around here. Chronic diseases we have a lot of expertise, particularly in diabetes and other chronic diseases. So something along a research center that would really focus on the more immediate need of the community where we are here at KSU. I think could really be helpful in demonstrating our impact and value added and have a profound impact, especially in underserved communities where we are.
Great. Any other final questions from the audience?
I want to just a little side note too, I know this is focused on Uganda and my global work, but I actually do research in other parts of the world and the US as well. And so, alcohol policy environment here in the US, for example, and working on some cancer disparities and, other things, of course, time permitting, but.
So how do you make those connections? So I think I feel like I know the answer to the question because you and I are friends, but how does one get all those different threads of research all over?
Well, I think first of all, I trained as an epidemiologist, right? This is technically a methodology. We count and we demonstrate rates in communities and risk and protective factors and also the consequences of health concerns. But the thread of the cancer research that I've emerged in, again, is health disparities. It is about the huge gap, for example, in African American and white women in terms of morbidity and mortality and health outcomes. Some of that work we're also doing in West Africa, so it's not sort of the global work, but there's an interesting potential genetic component to those health disparities. The alcohol policy environment work is really about understanding how marketing and sort of alcohol policies can reduce risk for violence and homicides and so forth. So there is sort of a common thread to the vulnerabilities. And
do you ever say no to a collaboration?
Very rarely.
That's what I thought. Okay, so thank you so much to Dean Swahn. Let's give her a round of applause. That is the first standing ovation we have had for this show, so that's pretty wonderful. I'm thrilled for Dean Swahn to be here. I think she represents a new KSU. She brings an energy and a passion to research, to teaching, to service, and we're just thrilled to have her here. So I just want to say a big thank you. This doesn't happen in isolation, and so again, I want to send out my thank yous to Heather Hedgepeth, who is my executive assistant extraordinaire, Tom Boyle, who helps with production of the video, Joelle Walls, who I've mentioned to you before, is our wonderful research communications director. And then very importantly, we have the broadcast and event AV staff in KSU's Department of Event and Venue Management that allows us to do a live and a simulcast. And this is a new format for us, and I really like it. The energy from the people in the room is quite exciting, but I know some people like to sit in the comfort of their own home or office to watch, and we want to give them the opportunity to do that. So thank you all for the work that you would do and for carrying this equipment around with you. They do not have a studio, so for that $5 million gift, we would like to get them a studio at some point. The next Dean's Showcase will be on October 29th. That's in a few short weeks, and we will be featuring Dr. Andrew Payne, and he is the Dean of the College of Architecture and Construction Management. We're really excited to hear what Andrew has to say, and we will be filming live on the Marietta campus. So he is an architect, researcher, and spatial designer, and he will be discussing some of his work focused on human use of urban spaces. So stay tuned for more information on, safe and sustainable communities. It's one of our 4 themes. So stay tuned for more information that will be coming out on our Office of Research website over the next couple of weeks. So with that, I say happy Friday. Please be safe, happy, healthy. Enjoy a beautiful weekend, and we will see you soon. Bye-bye.